So we talk about recovery after radiofrequency with microneedling and the profound device. Because we're going into the deeper layers of tissue, there is going to be a recovery attached to this. The best example is my example. This shows the right side of my face before treatment. This is what I look like the next morning. Each one of these little red spots represents a place where the needle penetrated the skin and heated the deeper layers in an attempt to encourage collagen deposition. This is the next day. The improvement you see in the jowls is actually related to swelling. The improvement took up to 5 months to see. When you look at the before pictures, you see the jowls, you see looseness in the neck, you see there is some loss of skin quality in the lower neck. This is 5 months post-treatment. You see improvement in the jowls and improvement in the neck skin. You're looking at the same line in this camera. This is the left face. You see the jowls better even 2.5 years later versus the neck where you see in the lower part here is improved. You also can appreciate from this view, this is the platysmal band, there's a platysmal band. We do not see improvement in this. This is the edge of the muscle that is loose, and it will not improve with anything less than surgery. We look on the front view, once again you can see the platysmal band, you can see improvement in the skin quality overall throughout the central neck. You look at the jowls are less noticeable on the frontal view. As we look at some other before and after pictures, we can appreciate these jowls have been tightened and the volume of the jowl has also been reduced. We did this with the two different hand pieces, part of it going into the dermis, part of it going into the fat that's lower, which gives you improvement in the jowl. If you look at the crow's feet, these deeper wrinkles that have been improved, the wrinkles are still there, but the depth has been reduced because of the increase in the collagen, the thickening of the fibroblast, and a better layer of hyaluronic acid. This is a really difficult part of the face that I have found. Even when I do a facelift, the quality of the skin in this lower part of the neck is very difficult to treat. With the facelift and treatment of the neck, what we're doing is tightening the skin. We're not improving the quality, we're changing the quantity of the skin. And you can see that these crosshatch wrinkles, this very thin, crepey skin, has been thickened and has been improved with the application of the radiofrequency energy. When we look at the looseness in the skin, once again we see tightening of the skin. The platysmal bands aren't going away, but you are seeing some improvement. When you see an older patient, this is something that we don't see often. We do see the occasional improvement to this degree where you're seeing there's some improvement in the jowls, there's an improvement in the lines in the face, but this would be considered an outlier improvement. But we do see it in these patients who are reluctant or absolutely don't want to undergo a surgical procedure. This is an option that we can use as long as they understand that this is not, it's not a facelift.